California Edition. I'm Brad Pomerance, and we are joined today by Don Knabe. He is a member of the Board of Supervisors in Los Angeles County, the largest county in our state. And I want to speak with you.
And the nation.
And the nation, that is true. If it were a state, it'd be larger than the state of Michigan,
right,
which is remarkable to me. If your district were a state, it'd be the size of, I think, bigger than 10 states, is that right?
It's bigger than 10 states.
Bigger than 10 states. So you have 2 million people which you are serving, which has got to be quite a challenge.
It is.
And a lot of them had been uninsured.
Absolutely.
So talk to us. We just finished the second cycle of the Affordable Care Act rollout. Covered California did as much as they could to get people to sign up early, but it looks like the numbers are not bad, not bad. What's happening in LA County and your district specifically?
Well, in my district specifically, but LA County in general,
right,
to put it in perspective, prior to this whole enrollment process, we had the largest uninsured population in America. We had the uninsured equal my district, over 2 million people uninsured, about 800,000 of that being children. So obviously through a very aggressive sign up for ourselves, we've signed up over 313,000, because keep in mind—
in your district?
No, throughout the
county.
Because the numbers, I got to put in county perspective.
I understand. No, it's all good.
Because it's all uninsured.
Right.
The point being is that the good news for the county,
right,
is that we have to be a competitor now. And we can't just sit back and say, woe is me, our job's to take care of the poor people.
Right.
Because if we don't sign those folks up, if they don't come into our program or come through any other program, through enrollment or whatever it may be, we truly are left with a non-paying customer. So it's good for us.
So does LA County have its own insurance plan as part of Covered California? I'm trying to understand the competition element.
It's not competition in the sense that we have our own Medicare, Medi-Cal sign-ups, registrations, Healthy Way California coming in. We sign those folks up. The point being is if we don't keep them in our system, since they have a choice now, and they go someplace else, that's where our problem begins.
The presumed good news is that with fewer people uninsured, as you suggested, they don't go to county as the location of last resort and leave the county with the bill. Is that what you're seeing? Are ER visits down, for example, and ERs being the county ER?
ER visits are down, but for the good reason. The good reason is in our electronic medical records and some of the things that we're doing and working between the hospitals, being able to communicate patient-wise. We have, with electronic ability to make appointments, things like that, waits have gone down from several months to less than 8 hours, in some cases less than 3 hours. And so on a positive side of trying to prepare, because I always told people from the very beginning, whether you're for it or whether you're against it, it's here, we have to be prepared. So we're trying to right our ship to be that competitor, to be that center of excellence.
I want to talk about Latinos living in Los Angeles County, and Latinos live throughout the entire region, including in your district. Early on, it looked as if Latinos were not signing up in numbers that were needed to make a significant dent. Latinos are disproportionately, or were disproportionately represented in the uninsured rolls. Right. We know that the numbers started to build, but there still is an undercurrent in the Latino community that they're afraid to sign up because of immigration consequences. Right. Even though you can't sign up unless you're documented, but somehow their families will get implicated. What have you heard on that front?
Well, I mean, I think the issue's still out there. It's probably underground more than it has been because of the conversation that's gone on. But I think, we've worked very hard on outreach. LA Care and other groups have worked very hard to get that information out. No, you're not going to get arrested. This is the thing to do and the place to come. You still got the debate over immigration reform that is, in everyone's mind. But at the end of the day, this piece is to sort of keep that potential public disease in our house so that we know where they are and how to treat them.
You also represent some beautiful portions of the San Gabriel Valley with large Asian American communities. And there's among some groups within the Asian American community, there's a fear of just getting involved in government at all. Many of them may have come from China communist China, and they just don't want to get involved in any government program whatsoever because all of a sudden the government's in their lives. What about those communities? Have you heard much about whether they've had some reticence to jump on board, to the extent they've needed to?
The reticence has been in with the older population inside of those that have come over and maybe living with the younger family members. And the younger family members are very accessible to the system and all that. I mean, our biggest issue has always been the Cambodian community because, you know, the killing fields and everything else, and the real reticence to deal with government on any level, whether it's registered to vote or whether it's health care. But the outreach again and using community-based groups of their own ethnic background have been very vital to sign these folks up. But there's still, in the Asian community, is a reticence at the senior level.
You mentioned the young. And as we know, as I'm told, I should say, I'm not an economist, but in order for the Affordable Care Act to be most successful, there needs to be a nice mix of young and old. The young paying their premiums dilutes the pool in the best sense because they're healthy. The numbers for the young have not been as high as had hoped. You know, there was a hope that maybe 40% of the total population would be young. It's closer to 30. Any anecdotes on the young and whether the young are participating?
No, that's still a major problem. I mean, when I talk about the single population, when we talked about the age, I'm talking about the family situation, married population, mom and dad, that kind of a thing. In the particular case of the young people, they're still rolling the dice, and that could be very expensive for them. And meaning not only in the premiums they pay, but in the penalties they'll have to pay. They will at some point get caught, but a lot of the young people, you know, it's just like anything else. When you're young, you feel invincible.
Of course.
And the same thing here, because trust me, this is not an inexpensive program. This is not inexpensive insurance. And so, I mean, there's still that major issue. Yeah, they have access, but they want to pay $1,500 a month?
At this stage, the tax penalty, if one does not sign up, is very low. I think it's $95. Is that right, sir? I mean,
I'm not sure,
it's
but
very
it's
low.
very low.
Are you hearing anything about now the fear of having this tax penalty, or is it just that's not in the zeitgeist?
It's not in there because I mean you don't want to disincentivize this whole process to make it. You know, you make some. I mean, right or wrong. I mean. As far as I'm concerned, if you're going to do it, it should have been high to begin with. I mean, you realize
I've heard that
at the end of the rainbow. I mean, that now to sort of say, well, we're going to let you off the hook, but next time it's going to, you know, the penalties should have been up front. I mean, that should have been the incentive to sign up.
I want to ask about the Medicare expansion. As you know, the U.S. Supreme Court has allowed states to choose whether to participate. At this stage, California is an active participant in the expansion. The Republican Governor Schwarzenegger jumped on board early. Some other Republican governors have not. How's the expansion going in LA County to the extent you're aware of that?
Well, it's going very well. I mean, from Healthy Way LA to Medicaid, not always been the easiest process, but I think we know how to do it better now. And so that's been a big help to us. That brings in very significant patient dollars to treat these folks. And so you have sort of a Medi-Cal, Medicaid hybrid there. And so, you know, we have worked very hard to make that transition. It's not easy, and a lot of people aren't aware of it. We're not a big, never have been, the state of California has been a big Medicaid state. We've lost a lot of revenue over the years, but because of Medi-Cal and things like that, people sort of get caught up in that. So this transition has been very beneficial.
In the next few years, all states who participate in the expansion will be required to pay 10% of the cost of those that were newly signed up. It's a few years off, but are the counties, the state, is there rumblings about that? Where are we going to find that money? Or is it kind of, that's someone else's problem?
No, it's not. Definitely not someone else's. That's definitely on the tips of our tongue. Where the money going to come from? You know, we're being told it should come from the state. But as we get closer, like so many other mandates, at the end of the day, it's going to be a 50-50 cost sharing or whatever it may be. That's to be determined. But I will tell you, I don't think there's a county around. All 58 counties are going to say, well, this is just going to be an easy road, and the state's going to pick up that cost.
In the final analysis, were you surprised that California was one state that was seen as kind of a success story as it relates to the ACA vis-a-vis other states?
I think we gave our folks more options instead of say all or nothing. You know, with the California program, Medi-Cal, Medicaid, this whole process has been one where we had better choices, but it's still a dogfight. I mean, it's still not where they want to be.
His name is Don Knabe, Supervisor in LA County. I'm Brad Pomerance. It's California Edition.